Hi, this is Dr. Antolak from theGentalDentist.com in Shelby Township, Michigan. 586-247-3500 is our number. And what I'd like to talk to you about is how do we sterilize our instruments at our office. We know that when people come into our office and get dental care, that there's an assumed thing that, oh, these instruments are sterile. These instruments are clean. How do people normally base that on? They normally base it on what does the office look like? How clean is the office? I can tell you at our office it's very important that we have cleanliness, not only what views there, but also with the instrumentation and everything else that is used here at the office. So I just like to kind of go through our sterilization techniques that we do with the instruments that are seen. So we have here, it's called a cassette, and in this cassette there are instruments that are in there. As you can see, I'm going to open this up here, and this is a set of instruments that we use for all of our procedures. And one thing that we do use is this thing that's in red. We use this to actually go in, if we're in the middle of a procedure, to go into our drawers. If we have something that we want to grab that is sterile, then we go into the drawer with this, we grab it with this, and we use it. And we keep this only for that purpose, is to make sure that the rest of the, let's say, drills or burrs, that doesn't get contaminated. We only use this, and we keep this set aside from the other things that we use. This is also our, it's called a bite block. A bite block is used to help hold your jaw and support your jaw while we do treatment. And there's a whole host of instruments in this cassette here. So what I wanted to do is to show you how it's processed. Let's say you get done, or somebody gets done with a procedure in the office, and then they leave. What happens after that takes place and behind the scenes? So, well, first of all, we'll take these instruments and we'll bring them in here, and if they need to be cleaned, we'll use this here to wash just the excess stuff that's on there. And then we'll come over here, and this is called our ultrasonic. This is really an important thing. This is submerged here, and this actually vibrates the instruments so that what it does, it's empty now, but it vibrates all the instruments and shakes them like this, and it microscopically removes the materials, the blood, the saliva, and things like that. It removes the gross amounts of that material, so then when it is sterilized, that it's clean. So anyway, so it goes from here, and once it's done there, we take it from here, we put it in the sink, then we rinse it out with water. Alright, so it's still contaminated, but it's clean now at this point. From here, we use one of two options. We'll either use something called our Statum autoclave. A Statum is something that is used to process instruments pretty quickly, and it goes, this cassette like this fits in here. It goes down, we put instruments inside of there, and it comes over the top, and then this fits inside of here. Alright? And then at that point here, we select what mode we want to use, and then it goes through it pretty quickly. The other option that we have is these instruments need to be sterilized here. We load up our autoclave, and our autoclave has a number of different shelves on it. Many of the instruments we use, especially the surgical ones that we use, we wrap them up first before anything is done. So, so these are wrapped up and they're ready to be sterilized. And when they are sterilized, they stay sterile until the moment that we open them up. Okay? Once they are done being sterilized and dried, then we store them in our cabinet here. And from our cabinet here, then we wait until we do the procedure. Then we take them from here to the room where they'll be used. We also sterilize our dental handpieces, the drills that go inside your mouth. Now, anything that is not metal that cannot be sterilized we'll actually dispose of. The things that we cannot dispose of, we'll put them here in our what's called our cold soak. And what this is for example, there's some syringes in here. This is a liquid that when it actually sits over about a 10-hour period of time, it actually sterilizes, not just decontaminates it, but it sterilizes the plastics that are there. Very few things that we do use that we do need to do this. Most of the things we use, like I said, throw away or we autoclave it. Now, another thing that is important is that these autoclaves are tested each month. You know, it can go through the process, but not necessarily will be sterile. So we use a little strip that gets tested by U of D Mercy, and on these strips there's a very bacterial, the highest bacteria, temperature sensitive bacteria. So we know that if that is killed, that the sterilizer is working and functioning fine. We've never had an issue or a situation that's taken place where they have not been sterile. But this is important to assure your safety of care, the level of care, that it's clean and healthy and everything else. Also in our rooms, we're going to take and we're going to sterilize instruments, and I'll show it to you what that looks like over here. So what we do in our treatment rooms to make sure that you have a safe environment to be treated in is we use these are called Santa Claus. These are not a wipe for babies, but it's actually used to wipe the rooms down. We store them up in this cabinet here. So we'll take any of the surfaces that have been used, and these will be wiped down very well. All right, and we also wipe out all these the suction units here, like this, and where they're being mounted here. We do that for each separate piece here. And then where the dental handpiece was used, this is the little motor on it. This is wiped down, and these are all wiped down here. And so everything seems to get that. For example, for plastics, this is for our handpiece, a controller for our electric handpiece. And this has plastic that's on there that will get disposed of. Also on the chairs have a fresh plastic. Every time a new patient comes in, they get a separate new piece of plastic here that protects your head and anything else from recontamination from people. Also on any of the controllers that we have, for example down here, that's covered with plastic. And also even the handles on our lights are we use a plastic like this, and then that goes right over the top of it like this. So that way we can control it, and then when we're done, we will go ahead and remove that and dispose of that. So all the plastics that are in here and the covers, these barriers, are used to do that, so that you can be assured that when you come in for care, that room has been gone over very thoroughly. The instruments that are used in your mouth are clean, and the instruments are sterilized, so that there's no questions. If you do have any questions, I'll be more than happy to show you how we do this process in our office. We're located in Shelby Township, Michigan, and our phone number is 586-247-3500. Thank you, and have a blessed day.